Okay, welcome to day 2 of conference. We're glad that you could be with us. I'm talking to you about autism again. And today I'm going to talk to you about what I wish you knew. But first of all, we're going to start off with the scripture from 1 Corinthians 12, 24 and 25. For our comely parts have no need, but God hath tempered the body together, having given more abundant honour to that part which lacked, that there should be no schism in the body, but the members should have the same care one for another. So first I want to say that I am not an expert in the area of autism. I have an interest in it. I've done some research, but I am in no way, shape or form an expert. So the material that I'm using today comes from Mrs. Sandy Dawson, who is the Training and Conventions Coordinator of A.C.E. in the United States. And Sandy is a special needs teacher and has huge amounts of experience. But I have added a few of my own little additions, so I hope it blesses you. So this is written from the perspective of a student with autism. And we're going to look at the top 10 things every child with autism wishes that you knew. So the first one, number 1, I am first and foremost a child. I have autism, but I am not primarily autistic. My autism is only one aspect of my total character. It does not define me as a person. As a child, I'm still unfolding, and only God knows what I might be capable of. Defining me by just one characteristic runs the danger of setting up an expectation that may be too low for me. And if I get a sense that you don't think I can do it, my natural response will be, why try? Number 2, my sensory perceptions are disordered. So that means that the ordinary sights, sounds, smells, tastes and touches of every day that you might not even notice can be downright painful for me. The very environment in which I live often seems hostile. I may appear to be withdrawn or even belligerent to you, but I'm really just trying to defend myself. So expect unusual responses to sensory stimuli. If a siren is outside, I may respond by rocking or stimming, doing one of the things that gives me comfort. But I will respond in some way that is not necessarily expected. By the way, I can't use 2 senses at once, so don't say, look at me when I'm talking to you. I can either look at you or listen, but I won't be able to do both. Sights. When there's an emergency, get right in my face. Poor visual acuity means that I can't integrate peripheral and central vision at the same time. So you need to be close up and in my face if it's urgent. My central vision is poorly developed, so don't try to force eye contact. You know, working with beads and small objects can help to improve my central vision. I have strong peripheral vision. To improve your relationship with me, sit side by side when you're talking to me. I'm happier when not looking directly at you. I'm fascinated by spinning things and mirrors. But if I'm looking at them and totally engrossed by them, I'm not hearing what you're saying. Fluorescent lights drive me crazy. They hum. It sounds like a swarm of wasps to me. Did you know they flicker at 60 pulses per second? So to me, the room seems to pulsate, and it hurts my eyes. Ceiling fans can make me dizzy. Loud prints or colours can make me queasy. And sometimes the glare on white paper can hurt my eyes. Did you know I can use coloured overlays to help with this? Some coping strategies for sensitivity to light could be: I can wear a visor or a hat with a brim. I can get Erline lenses or rose-tinted glasses. Or you can change the lights or use as much natural light as possible. I can have a desk lamp that is not fluorescent. What about sounds? Well, normal sounds can be painful. A cricket can sound like someone shouting in my ear. My hearing is actually hyperacute. But tonal distortion may make it difficult for me to interpret auditory information. I'm listening, but I just can't always work out what it means. A toaster popping, a clock ticking, or tapping fingers can all be overwhelming for me. I will often cover my ears with my hands when overwhelmed by sounds. I'm not being rude, I'm trying to protect myself. Noisy, confusing places can cause me to have a meltdown. What about smells? My sense of smell can also be very sensitive. Something that smells appetising to you may smell gross to me. Spicy or sour food can be really problematic. Even the sweet scent of perfume can cause me to be nauseous or even to be sick. Smelly bodies can also make me feel sick, so please think about where I sit in the learning centre. Obviously, this all affects how I feel about food and people. What about taste? Well, my taste buds do not actually taste the same things you do. So the yummy hamburger you're sure I will like could taste terrible to me. Don't be offended. Ask me what I would like. I probably won't like spicy, extremely sour or strong tasting foods. As my taste buds are very sensitive, these tastes are just too strong for my palate. What about touch? My skin can be overly sensitive. I don't like light touches on my arm or my head. It has nothing to do with you. I struggle with games where people touch me. I can be irritated by certain textures, the label in a shirt, walking barefoot on different surfaces, or food textures, and this may limit my choices. I will normally resist being held. I don't like to be touched. I can have extreme reactions to temperature changes. I feel it much more intensely. Number 3. Please remember to distinguish between I won't or I choose not to and I can't or I'm not able to. Receptive and expressive language and vocabulary can be major challenges for me. So when you tell me to describe something, I'm not going to use lots of adjectives. I'm going to tell you exactly what it was. It isn't that I don't listen to instructions, it's that I just can't understand what you're telling me sometimes. And when you call from me across the room, this is what I hear. Noise, 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 noise. Billy, noise, 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 noise. Instead, come and speak to me in simple words. Please put your paces away now, Billy. It's time for lunch. This tells me, 1, what you want me to do, and 2, what is going to happen next. Now it is much easier for me to comply. Remember that I tend to over-focus, and sometimes I just don't even know that you're talking to me. Number 4, I am a concrete thinker. This means I interpret language very literally. There is no grey in my world. What you say is what you get. So if you go and tell me to go and put my head in a bucket of water, that's exactly what I'm going to do. I lack the ability to be flexible or spontaneous. I am rigorously logical. I base my knowledge on facts and I don't do fluff. I'm good with questions that have yes and no answers. Do you want a pizza? Yes or no? I'm not good with questions about feelings. How did you feel about that movie? I don't understand that at all. Give me checklists with a time frame, not exact times or I will obsess over it. It's very confusing for me when you say things like, hold your horses, cowboy, when what you really mean is, please stop running. What's a cowboy got to do with it? Don't tell me something is a piece of cake when there's no cake in sight, and what you really mean is, this will be easy for you. Idioms, puns, nuances, metaphors, allusions, and sarcasm are all lost on me. I do not understand them. I also don't understand small talk. Why do people ask questions they don't want answers to and then lie to other people? It doesn't make any sense to me when you say, how are you today? And I'm supposed to say, I'm fine. But I'm not really fine. It's too noisy and the lights are too bright. So if you say to me, how are you today? I'm going to say, it's not good. The lights are too bright and it's too noisy. Don't give me too many choices. Would you rather draw or listen to music? Don't ask, what do you want to do? Give me specifics. When someone breaks a rule, I will tell them about it. When Mum and I are in the 15 or less items or less line at the supermarket and someone has too many items, I will count them and tell them they are breaking the rule. Yes, I'm the checkout Nazi. I see these things and the rule is there and people should follow the rules. Number 5, please be patient with my limited vocabulary. It's hard for me to tell you what I need when I don't know the words to use. I may be hungry, frustrated, frightened, or confused, but right now, those words are beyond my ability to express. Sometimes having pictures that I can point to helps me to let you know what is happening. Be alert to my body language. Withdrawal or agitation are signs that something is wrong. The flip side is, sometimes I may sound like a little professor, rattling off words or whole scripts well beyond my developmental age. These are messages that I've memorised from the world around me to compensate for my language deficits. It's called echolalia, and I don't necessarily understand the context, But I know I'm supposed to say something, so I do, whether it makes sense or not. Number 6, because language is so difficult for me, I am very visually oriented. Please show me how to do something rather than just telling me. Be prepared to show me multiple times. Lots of consistent repetition helps me to learn. I need a visual schedule, a goal card, and sometimes even more of a daily list. We talked about that in the previous one. It helps me to remember what comes next so I don't get anxious. Pictures help my comprehension. Make sure books or lists have pictures to help me understand the context. I need non-verbal forms of communication. Number 7, please focus and help me build on what I can do rather than what I can't. Like any other human, I can't learn in an environment when I'm constantly made to feel like I'm not good enough and I need to be fixed. Trying anything new when I am almost sure to be met with criticism, however constructive, becomes something to avoid at all costs. Look for my strengths. I pay intense attention to details. I do deep studies in areas of interest. I am logical. There are no grey areas with me. I think differently. I am an independent thinker. I am a strong visual learner. I am direct in my communication, and I am loyal. Did you know there is more than one right way to do most things? Let me use my unusual thought processes to achieve what you want me to do. Number 8, please help me with social interactions. I will usually be most successful in areas that don't require high degrees of social understanding or interaction. I don't mean to be rude, but I will tell you when you are wrong. I don't know how to mince words or to play social games. They don't make any sense to me. It may look like I don't want to play with the other kids on the playground, but sometimes it's just that I simply don't know how to start a conversation or enter a play situation. I need you to help me do these things. If you could encourage another student to invite me to play in the group, that would be a big help. I do best in structured, contained play activities that have a clear beginning and end. Large open spaces confuse me, but I do understand rules. I don't know how to read facial expressions, body language, or the emotions of others. So I appreciate ongoing coaching in proper social responses. For example, if I laugh when Emily falls in the playground, it's not that I think it's funny. It's just that I don't know the proper response. Teach me to say to Emily, "Are you okay?" Parallel play like cross-country running, karate, etc. can work well for me, not group sports. When I get older, I need to be trained in interview skills. I need to practice for phone interviews. I fake eye contact by looking at my nose. I'm often more comfortable to stay in technical areas working with things rather than people. Did you know a recent study of people working in Silicon Valley, California, shows that 1 in 30 of the people working there have some level of autism? People with autism and Asperger's syndrome are often drawn to technical jobs. Number 9, try to identify what triggers my meltdowns. Did you know meltdowns are even more horrible for me than they are for you? They occur because one or more of my senses has gone into overload. You see, I don't like surprises. Not understanding a reason for sudden change can be terrifying for me. I can be overwhelmed with too many choices, or I don't understand the answers to questions. If you can figure out why my meltdowns occur, maybe they can be prevented. Can you keep a log noting times, settings, people, and activities that happen before or during my meltdown? And we might find a pattern will emerge. And then I can get help from you. Try to remember that all my behaviour is a form of communication. It tells you when I can't that something is wrong in my environment. During meltdowns, I have a harder time in communication and making wise decisions. Please look for frustration and anxiety. This is a clue that a meltdown may be imminent. Please stay calm during a meltdown. The meltdown world is a terrifying place for me, so please don't be angry or panic. Meltdowns are unique to each individual, but some common factors are: I will freeze when overstimulated and will have trouble answering questions. Give me an out from the topic or a break. Using the downtime card here can be helpful. I will fixate when sensory overload occurs. I may break into my special topic and fixate to calm myself down. Using headphones for noise and a hat or visor for excess light can be helpful. Please be flexible with me during these times. I need a plan B to deal with sudden change, including substitute teachers, fire drills, or anything out of the ordinary routine. Always have a plan B decided beforehand. A what if. Then you can remind me of the plan B and I can move on. Transitions can cause me to shut down or disengage. Changes at home, school, in life, changes to the school, to the lunch process, a new home. All of these things can give me stress, and I can manage this much better if I have advanced warning. Sometimes during a meltdown, I will fight or run. I may lash out. As adrenaline builds, I have to have some kind of physical activity. I may hide, which means I will usually go to a safe place. Maybe we can choose a safe place and then you'll know where I've gone. I may run. It can be dangerous when I just run. These are called monotropic moments and are the second greatest cause of death in people with autism. I can become over-focused on one thing, getting away, and nothing else matters. I don't see anything else. I don't hear anything else. All I can do is focus on getting away. So I run without any thought to danger. Please don't leave me unattended. Once you figure out my meltdowns, please don't put me in those situations. Take the initiative to help me. This is the story about a little boy and his mum at McDonald's. Mum took her son to McDonald's every Tuesday at 10 a.m. This Tuesday, the schedule got delayed and she and a friend arrived with the boy at McDonald's at noon. The frenzied atmosphere while waiting to order, the noise, the crowd of people, the confusion caused anxiety for the boy. First, he started to hit his mother on the arm, repeating, "Mum, Mum, Mum." Next, he started to jump up and down and scream. Then he fell down on the floor and silently rolled back and forth. The adult friend, who had high-functioning autism herself, scooped him up and ran outside the McDonald's. I want you to think about this scenario. What could Mum have done in this situation to change the outcome? I'm not going to tell you the answers. I want you to go away and think of it and think about what could you do in that situation with that child. Remember, tantrums are intentional. They're intentional manipulation. You're not giving me what I want. I am going to throw a tantrum. But meltdowns are not planned or desired by the child. After a meltdown, I am exhausted, humiliated, and often I don't even remember what happened. So we come to number 10. Love me unconditionally. I did not choose to have autism, but it is something that is happening to me, not to you. Without your support, my chances of successful, self-reliant adulthood are slim. With your support and guidance, the possibilities are much broader than you think. I promise you, I am worth it. And finally, 3 words: patience, patience, patience. Work to view my autism as a different ability rather than a disability. Look past what you may see as limitations and see the gifts that autism has given me. It may be true that I'm not good at eye contact or conversation, but have you noticed I don't lie, I don't cheat at games, I don't pass judgment on other people. It's also probably true that I won't be the next Michael Jordan, but with my attention to fine detail and capacity for extraordinary focus, I might be the next Einstein, or Mozart, or Van Gogh, or Stonewall Jackson, or Lewis Carroll. They all had symptoms of autism too. All that I might become won't happen without you loving me. Be my advocate, be my mentor, and we'll see just how far I can go. Remember, there is one body and one spirit, even as ye are called in one hope of your calling. But unto every one of us is given given grace according to the measure of the gift of Christ. And that's Ephesians 4, verses 4 and 7. I pray that this has given you some insight into the world of a child with autism, and that you will take this and think about it, and think about your responses in your learning centre. God bless.